Good afternoon, everyone. Thank you for having me here today. What I'm going to try to do over the next 10-15 minutes is give you a very quick overview of what's happening from a survey perspective among the food grocery manufacturer, not the manufacturers, the food retailers around the country, and then what some of our members are actually doing in store, directly speaking to children and their parents about healthy food choices and alternatives. So a quick little background, FMI is the trade association that represents the supermarkets around the country. We operate 25,000 retail food stores nationwide and approximately 22,000 pharmacies. And I only mentioned the pharmacy piece because that's my education, so I always put a plug in for the pharmacists out there in the supermarkets. Just very quickly, today's supermarket, on average, consumers visit a supermarket 2.2 times every week. Supermarkets carry over 38,000 items. Our profit margins are very slim, 1 to 2%. And differentiation from competition is really key to the retailer's success. And I want you to remember that as I go through the next few slides. So let me talk a little bit about health and wellness in food retailing. Annually, FMI does two big benchmark research reports. One is FMI Speaks and the other is Trends, consumer trends. So from FMI Speaks, this is what the CEOs and senior executives within our retail member companies thought about. On the left-hand side here, you have the top 5 trends as reported by retailers. And if you notice, health and wellness and natural and organic are in the top 5. On the right-hand side, it really talked about what are retailers seeing in terms of where they're putting their priorities, where shoppers are still looking. And even at a downturned economy, it was still a real big commitment among the retailers to continue to invest in health and wellness and in-store services that really help parents and children find healthy alternatives. So from our trends report and from a few other reports as well, now's what the consumer is saying. And we hear over and over in a lot of our reports that it's not tell me what to take out of my diet, but it's tell me what I can put into my diet. Tell me what to eat. Don't be preachy at me. Give me some good ideas. There's so much information out there. As supermarkets, they're really looking for the supermarket to give them some solutions on how they can make healthy food choices for their families. This is a study that was done by Catalina Marketing in 2012 that talked about what influenced parents in making food choices in stores. And if you look here, the top 3 items are nutrition labels on packages, couponing, and store advertising circulars. So what we are doing is really, as retailers, really focusing on the couponing, focusing on that in-store nutritional education to really help people make better choices. When we asked our retailers what if you go back to that first slide I talked about, strategic differentiators are really, really important to our folks. If you look at our Speaks and Trends survey, 80% of food retailers use consumer wellness as a competitive strategy. I run our health and wellness area within FMI, both from the CEO level board committee and our health and wellness council, and there's a lot of sharing of information in that council, but it gets very competitive sometimes outside of that council world. They don't want to share too much because they know that's a competitive advantage for them in their market. Concept testing is certainly alive and well in marketing of healthy products, especially to parents and children. From programs that put together pharmacy dietitians, nutritionists, and other store associates, they're doing in-store cooking classes, putting together store tours. And I'll show you a little bit of that later from some of our members that actually shared some information about specifically what they're doing in the stores. Some of you are probably very aware of what the Food Marketing Institute and the Grocery Manufacturers Association are doing in terms of labeling. We put together a voluntary program called Facts Up Front. And if you remember back to that slide, the consumers are really looking for information that helps them with nutrition labeling. This takes the facts, the nutrition facts panel on the back, and clearly articulates what that means in very quick lay terms to a consumer shopping. You're going to see, we've got some of our members are implementing this now on both the manufacturer and the retailer side. In 2013, you'll be seeing a lot more as far as advertising, in-store signage, You'll see here the picture of the plate with the fork is an ad that you might see in a magazine. The product with the red shelf labels is what you might see in a retailer store on an end cap. That's really talking about the products that are available in the store with the Facts Up Front labeling on them. We did a survey earlier this summer that we directly talked to the folks involved in health and wellness in our store. So it was dietitians, it was pharmacists, it was health and wellness, marketing and merchandising professionals. And we did a quick survey to see what they were doing in their stores related to the health and wellness strategies that they had put in place. So let me quickly go through some of these. And if you look here, there's 79% of our stores are offering some type of store tour. Over to the right, you'll see 76% of our stores are offering store tours for children. 57% are doing store tours involving school programs. And what they do specifically when the store tours are with children and school programs, they bring in kids and they do a store tour of how to pack a healthy lunch or how to incorporate vegetables with their parents into dinner. And this is a really big growing trend within our supermarkets of what these store tours are offering. They also do specific disease store tours for diabetics, weight management store tours, healthy eating store tours. We've had some recently of nutritional labeling, how to read the label, but really how to, when that shopper hits the front of the store, how can you, no matter what age they are, no matter what their needs are, how can we put together a tour inside the store, typically with a dietitian, that really walks them through the store and gives them a good shopping experience when they're there. 59% of our companies reported that they provide nutrition counseling. And this slide, what I really want to highlight is supermarket dietitians today and where they're employed. If you look here, in-store, 33% of the dietitians that were surveyed are in-store dietitians, hands-on with customers. 52% of them were employed regionally, where they may have several stores, a part of a geographic area within the corporation that they work for. And then corporately is where we see most of our dietitians that are within the supermarket ranks employed. Many companies, if not all, have at least one dietitian on staff now. And that's really something that we're seeing as a growing trend. 50% of our stores had reported that they had front-of-pack labeling for their private brands. And you'll see here just a quick array of what they're labeling. Over half of our retailers are displaying healthy for you items on their aisles or end caps. Almost 90% are providing healthy recipes to their members, either through recipe cards in-store kiosks, at point of purchase. If you're in the chicken department or in the fresh produce and vegetables department, you may be able to take home healthy alternative recipes that way, or through the store's website. And 98% of our stores now have some type of a health and wellness related website where you'll see all of the information that they have here available. And specifically, I want to call out the area for parents and area for children, because that, again, that really is a growing trend. And you'll see in my example from Wegmans later how they're playing upon that. And apps, I know someone here is going to be talking about electronics, but smartphone apps are really growing in leaps and bounds in the retail supermarket environment, helping folks with their supermarket specials. If I have chicken at home, what can I do with chicken when I'm shopping in the grocery store? What are some good healthy recipe alternatives? So let me take you through a couple examples of what some of our members have shared with me to share with you today. At HEB, located down in Texas, they have a healthy program where they're incorporating not only for their shoppers on the food side, but they're really looking at working with, and they do a lot of targeting here with young families, working with food, body, and life. So it's food. It's getting programs together in their local communities, in their neighborhoods that are marathons, that are walking, that are doing something to really excite the community about. It's not just about what you put in your body, but it's the exercise and the rest of, it's a real well-balanced program that they put together down at HEB. Hy-Vee is one of the stores that if you haven't been to West Des Moines, Iowa, I would encourage you to go. They are one of the few supermarkets that employs a dietitian in all of their stores. They have a big corporate group of dietitians that really help programs in place. But those dietitians in store offer healthy kids cooking classes. They work with education programs in schools. They work with My Plate. They actually have programs in the store that helps folks shop to the My Plate criteria. They have a Hy-Vee Sprouts program that talks about involving children in the growing of fresh fruits and vegetables in their garden. If they don't have a garden, there are actually gardens at the Hy-Vee stores that the kids can participate in, and they're involving the schools with that as well. They have a story and a snack class for toddlers in their stores. So they're really innovative in what they're doing to, again, talk to the kids themselves in the supermarket and to be able to work with the parents of the children in making some healthier choices. They do some back-to-school displays. Here, again, here's what's in your lunchbox. They do classes with brownies where the brownies can actually earn a badge of what are some healthy alternatives. It's almost like a test of should you pack in lunch, what should we be having for dinner tonight. So they really talk to the kids directly. This is an example from Wegmans of their fresh stories. They have, oops, I'm behind, sorry. Their fresh stories where it's all about cauliflower, love your white vegetables this month. So the dietitians are actually blogging. They reach out to the schools and the teachers with some of these blogs as well and have a communication that way. Wegmans also does cooking classes in store, and they do store tours to help kids identify healthy choices. They do a lot of community events as well. Giant Eagle, they do, and if you look over here to the left, they do, through dietitian services and classes, you can actually schedule appointments with Giant Eagle for a weight loss class, for nutrition life coaching, diabetes classes, and a lot of our stores are offering specific classes that you can sign up at a specific time. And I think that's a real growing trend in how they're trying to market in store some of those services that are available to the shoppers. Just a couple, there's an actual picture there up on the left of a dietitian field trip in stores. You'll see down there at the bottom there's a community group of young kids who came in, and that's actually in the store where they sit down with the kids and they educate them on good nutrition and what's available to them in the grocery store. And then Giant Eagle, as many of our members do, go out into the communities too, so it's not just at the store, but they're trying to take what's valuable at the store and move that out into the community, whether it's at a Pittsburgh Steelers event for kids or at the local museums. And I wanted to just highlight, since we're also the foundation head at FMI, we work this year with the Fuel Up to Play 60 program, who has healthy living grants. And what the grants are, and I'm delighted now, we have almost 1,000 schools that have applied for the grants for this year, and it's a new grant for Fuel Up to Play 60. But what it does is it gets the kids, again, reaching out to that health and wellness in-store marketer or the health and wellness dietitian to do in-store classes, in-store tours, or in-store, yeah, I said that right, in-store classes and in-store tours about healthy snacking ideas. Again, just talking to those kids and getting them as much information about what should be on their plate so that the children know themselves, and it really gives them hands-on support. And then this was just to highlight that employing dietitians in the supermarket is paying off. The New York Times has recognized that. I know many of you in the audience here are dietitians, so it's nice to get that credit, and it is a growing trend that we're seeing within our supermarkets of really investing in this area, investing in health and wellness. We still have a lot of our members are looking to discover what that strategy looks like for them. But in all cases, we are really seeing an increased emphasis of health and wellness offerings inside the stores. So while supermarkets are in the business to sell food, meeting the needs of the customers is always going to be their top priority. And I think we're saving questions. That was my last slide. So I think we're saving questions for the end.